Hey everybody, Dr. Ben Fung here again, just recording part two of this kind of multi-blab thing as a video blog. In case you missed the first one and are wondering why I'm dressed this way, it is really cold in San Diego, which is weird. We're in the 40s for whatever reason, and I know cold because I'm from Michigan, so I'm wearing my old college beanie and my jiu-jitsu gi to keep warm. And in case you don't know, this is Trogdor the Burninator from homestarrunner.com from a really random Strong Bad email. It's actually a lot of fun. It's random entertainment from the old days. You can check it out. It's a good laugh. But this is all about acute care physical therapy. And I'm just reading from my notes here. My passion, my heart's passion in physical therapy is still in acute care, just because I feel it's one of the most diverse environments. It's stereotyped a little bit as, just going from bed to bed and getting people out of bed and walking them or dangling them. But quite honestly, if you've ever been in the environment, it's way more than that. And especially if you're practicing at the top of your license, it is so much more than that. It was my ultimate game changer. I went into PT school like a lot of people thinking about, it's all about outpatient. It's sports medicine or sports or orthopedics. Like, I'm going to be a manual therapist. I'm going to, just be awesome like that. I love that environment too. And it's a big part of how I practice. But an even bigger part of how I practice comes from the acute care environment. And, my rotations in school started like this. I had an inpatient spinal cord, neuro, acute rehab setting as my first rotation. And, it actually kind of warped my brain a little bit because I had no clue what I was doing. I was like, well, there's no mobbing here. What am I going to do? And I worked with a lot of spinal cord patients. I did a lot of brain injury as well and stroke, and it really kind of revamped my idea of where physical therapy fits in the space of healthcare. My second rotation was with a very strong ortho manual situation with somebody who graduated from the ortho residency, as well as one of the leaders in the fellowship for manual therapy. And, I really took that also into consideration and realized that it's really quite a specialty, but it didn't resonate with me for whatever reason. I loved it. I really did, especially doing the hands-on stuff, but it didn't impassion me the same way the inpatient situation and setting did for me. And then my last rotation ended up being in the acute care hospital. And for whatever reason, that charged me up. I got to do everything. I even got to do manual. I got to do wound care and many types of wound care. And it really changed my view on things, because I felt that in the acute care environment, you were able to practice at the top of your license, right? Doctors of physical therapy are supposed to be doctors, and we are doctors. But if we remain ourselves to what we've always been known for, I feel that we lose a little bit of value behind that DPT. So let me just go through the top 5 ways that acute care was my personal ultimate game changer. I'm not advocating that everybody suddenly goes to acute care. It's simply that I think that if you're a student, try to get an acute care rotation. And at the very least, if you're a new grad, maybe find your way to work at an acute care setting per diem, even once a month, just to really supercharge that area where you get to, practice at the top of that license and the top of your credentials. So number 1, acute care was my ultimate game changer because it was the best application of my knowledge base. Getting the Doctor of Physical Therapy degree, you learn so much more than what is, generally applied in the outpatient setting. All that pharmacology, right? All the imaging that we learn, all the pathophysiology, all of that is available to you in the acute care setting. It's also the highest level of clinical diversity. I actually personally did plenty of manual and ortho and vestibular when I did the emergency department and short stay stuff in the acute care setting. I helped a little bit of kind of pre-piloting that. And I found that there's so many opportunities to practice what is considered outpatient in the acute care setting. It's probably the highest level of clinical complexity, which means, they're going to have 20 different medical conditions and, 100 different medications that you're going to have to worry about in how you implement your physical therapy interventions. It's not simple. And that's good because it makes you think creatively. It makes you think with an innovative lens, and it forces you to prioritize. And I think prioritizing is that secret sauce, where you take a look at emergency situations, right? Doctors have to prioritize what's most important, right? And that's what separates out a doctoring profession from one that isn't necessarily at that same level or scope. Intensity. There's super intense medical situations, the most intense that you'll ever see, and especially in patient care scenarios, right? All the patient families hovering there, and the nurses might be hovering, and the physicians may be hovering. I remember the situation where, just because my background and training in trauma and acute care and wound care was there was this patient where he had this. I think it was a T3 through pelvic fusion, and he was just so upset and ornery and refused to receive any care. He didn't have his dressing changed for like 2 or 3 days. It was awful, and nobody knew what to do, and I wasn't technically a wound care PT in the hospital at the time, but because I had the training, I just stepped up and said, look, we got to get this done. Otherwise, this is going to get infected. It's going to be bad, right? It's going to be a very bad situation. And a lot of that confidence and know-how came from the exposure and training in the acute care setting. And it's nice to have. It's nice to be able to step up to those situations. And finally, the biggest game changer for me personally was that acute care, being that it's a hospital, is a very large political canvas. It's not like a multi-tiered and multi-site outpatient concern, nor is it like a multi-regional home health concern. It's one big medical campus with a lot of political views and a lot of political interest within the healthcare space, right? Nursing wants their way, imaging wants their way, various physicians want that, insurance wants this, the hospital administrations want something else, and navigating all of that really sharpens your abilities within the healthcare space, and really makes you that much more sharp of a professional. So those are 5 ways. You can read more about it in the text below, in this blog, but those are 5 ways that acute care was personally my ultimate game changer in my career in physical therapy. And I highly advocate that you explore it. Again, if you're a student, try to get a rotation in it. And if you're out practicing now, see if you can get a little exposure. If you're not familiar with it, just through some per diem or some temp staffing positions. I promise you it's worth that reinvestment. You may find yourself impassioned by it, and quite honestly, I think that, acute care, I'll just make sure I don't miss anything in these notes. Yeah, I feel that acute care is one of those places that really has a lot of opportunity to offer the future of healthcare, especially in the emergency department, right? Because so many people are still, even in our current transition in healthcare, they're still going to the emergency room, as their primary care, and it's an enormous cost, and it's an enormous burden on the lattice of healthcare. So, I can talk about this forever, but I just wanted to make this, kind of a quick video blog just to supplement what I'm writing here. It'll be available later this week. So I hope you enjoyed it. Shoot me any questions, tweet me at Dr. Ben Fung. And I think that's about it. So yeah, it's late. I think it's time to go. So I'm Dr. Ben Fung, and I'll see you later.